Are you getting a few more facial hairs than you'd like? Here's what's causing it and how to fix it. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist in Northern California. I'm here to help you understand your skin and your hair and your nails and find products that work for you. So if that sounds good, give this video a thumbs up and subscribe to the channel. Before we discuss how to treat or address female facial hair, it's really important that we understand the causes of excess female hair growth. Now, it's normal for women to grow hair on their face, but typically the facial hair that women grow are called vellus hairs, and they are most classically identified as peach fuzz. Now compare that to the hair that we classically see on men, which is thicker and more coarse, and those are called terminal hairs. And as a female, how much peach fuzz you grow on your face is really determined by genetic factors. And there's a condition called hirsutism in which women will grow hair on their face and body in a classic male pattern, meaning that they might notice thicker, darker hairs in the beard and mustache area, as well as between the breasts and on the lower body. This is considered a deviation from the normal female hair growth pattern, but we do see it more commonly in certain ethnic groups. For example, women from Mediterranean, South Asian, and Middle Eastern backgrounds are going to grow hair in that pattern more commonly, and that is just due to their genetic makeup and not any other underlying cause. Hirsutism is estimated to affect about 5 to 10% of women, and this not only depends on their ethnic background, but also their age and their menopausal status. We also tend to see this pattern of hair growth in people who have androgen excess. And androgens are hormones that circulate in our body, like testosterone, that give us classic male features like certain patterns of hair growth or a deeper voice. Where we will often see women with androgen excess are in conditions like polycystic ovarian syndrome, also called PCOS. Women with PCOS tend to form benign cysts on their ovaries, and this can also lead to androgen overproduction. We also see the formation of excess androgens in people who have adrenal tumors, people who have a condition called congenital adrenal hyperplasia, as well as in people who have Cushing's disease. Also, as women go through menopause, they will notice that they tend to have more hair growth on the face. And that is not because they are creating excess androgens, but rather their estrogen levels are decreasing. And so the relative proportions of hormones shift to a male-dominated pattern. The reason I wanted to take a moment to explain hirsutism, because this is in contrast to another overgrowth hair condition called hypertrichosis. And hypertrichosis is characterized by excess hair growth in areas of the body that are not dependent on androgens. So you're not going to see that classic male pattern distribution of hair if you have hypertrichosis. And oftentimes people with hypertrichosis will develop excess peach fuzz and terminal hairs most prominently on the face. Some people can be born with something called congenital hypertrichosis, where from birth they always have excess hair. If you think of the wolf man, that is what he has going on. And I don't want to be alarmist, but hypertrichosis can also be a sign of an underlying cancer. So especially in an elderly person, if they suddenly start growing lots of face and body hair, that would be quite unusual, and it should prompt someone to evaluate them for cancer. Hypertrichosis has been associated with many different cancers, but we most commonly see it with things like lung cancer, breast cancer, uterine cancer, colorectal cancer, bladder cancer, and lymphoma. I also don't want to discount the fact that certain medications that people are placed on can cause them to grow excess hair. And it's really important to understand that, because when we talk about interventions for treating excess hair growth on the face, we want to make sure that someone is not on a medication that's perpetuating that issue. Some of the most common medication culprits I see in my own practice as a dermatologist are minoxidil. So people can use minoxidil topically to help grow their hair on their head, but that can also transfer to the face and cause excess and unwanted facial hair growth. We also will see this for people who take oral minoxidil. So there are some people who don't want to apply minoxidil to the top of their head, and instead they want to take it in pill form, but that can lead to hair growth elsewhere on the body that is undesired. I also see it a lot in my patients who are on some type of testosterone supplement. And you might be going, well, aren't men just taking testosterone? But lots of women are placed on testosterone as some type of hormone therapy, especially post-menopausally. And then they'll come in with new problems related to testosterone, like acne or excess facial hair growth. And if you're someone who's struggling with excess facial hair growth, I strongly recommend an evaluation by your primary care doctor or even your dermatologist so that you can have some type of diagnosis to work off of. Now, whether someone has hirsutism or hypertrichosis, it's always important to make that identification before you start treating it. For my female patients with hirsutism, which is the most common type of excess hair growth that I treat in my practice, we are often discussing topical and systemic medications to address that. If someone only wants to use topical things, I start with recommending something called eflornithine. This is a cream that is applied twice a day, usually to kind of the beard and mustache area, and it works by thinning out those thicker terminal hairs. It works by inhibiting an enzyme called ornithine decarboxylase, which is important in the hair growth cycle. You usually need to apply this product twice a day for at least 6 to 8 weeks to see results. And then, like any of the interventions I'm going to talk about, you need to continue them in order for them to continue to help with your excess hair. And what I mean by that is your hair might be thinner or less prominent when you're using this cream, but if you ever stop this cream, your hair will return to baseline. Most commonly for my patients who have PCOS due to androgen excess, so they either have PCOS or they're getting worked up for PCOS and we've eliminated all other causes of hyperandrogenism, then I'm giving something like a birth control pill. And not any birth control pills, I'm talking about birth control pills that are a combined estrogen and progesterone pill. This helps regulate and lower the androgen levels that are produced by the ovaries and the adrenal glands. Now, in combination with a birth control pill, we can also prescribe a medication called spironolactone. And you may have heard me talk about spironolactone before because it's very helpful for treating hormonal acne in an adult female, and kind of because of a similar mechanism of action, it affects your androgen levels. Spironolactone can help decrease the rate of testosterone production and help you clear excess testosterone out of your system. Similar to the topical interventions, with oral interventions, whether that's birth control pills or oral spironolactone, it typically takes 3 to 6 months to see those results. And once you do see those results, and if you see them, you need to stay on these medications to maintain those results. Aside from taking oral medications or using topical medications, weight loss has also been shown to help with androgen excess. But let's talk about non-medicated things that you can do for excess facial hair growth as well. And these interventions are really focused on removing the hairs that you actively have. Number one, shaving. I know it can feel a little bit taboo to be a woman shaving your face, but if you're growing hair, you can shave it off anywhere. If you're looking for any type of tutorial when it comes to face shaving, I have a couple of videos on here and I will link them in my description box. And then of course there are alternatives to shaving. For example, using a chemical depilatory cream. I would say the most common chemical depilatory cream out there is Nair, and you have to be careful with using this on your face. You want to start by patch testing it, maybe on your inner arm, to make sure it's not causing too much irritation to your skin. For some people, they find a lot more success and a lot less irritation when they're using a chemical depilatory cream compared to shaving. Most of these chemical depilatories utilize an ingredient called thioglycolic acid, which essentially dissolves the protein in your hair. So you do have to be careful if you're using it on your face. You don't want to put it anywhere near the hair you want to keep, like your eyebrows. Other ways to remove your hair, and which are completely okay if you have hirsutism, are things like threading or waxing or sugaring. But keep in mind, these are all temporary ways to address that excess hair. If you're looking for something a bit more permanent, then we get into the category of laser hair removal and electrolysis. And one thing I want to be very, very clear about is no matter how you are removing your hair, whether you're shaving or waxing or getting it lasered, treating the excess hair on your face is not going to make it come back thicker or darker. If you're not familiar, electrolysis uses an electrical current placed into the hair follicle to basically destroy that follicle's ability to grow hair. Electrolysis uses the technique of applying an electrical current into the hair follicle in order to make that hair follicle no longer be able to produce hair. And because it has to be done follicle by follicle, it's really best suited for small amounts of hair growth or confined areas of hair growth. And it is what makes it more ideal for the face. The upside of electrolysis is it doesn't matter what color your hair is. So whether you have black hair, red hair, blonde hair, or even white or gray hair, electrolysis will work for you. Now contrast that to something like intense pulse light or laser hair removal. In that case, the laser actually needs to see brown or black pigment in the hair in order to target it. And although laser hair removal can be a beautiful thing, if you have blonde or red or white hair, it's not going to work for you. And similar to electrolysis, laser hair removal can be uncomfortable, but I would say compared to electrolysis, that's on its own level. And laser hair removal will also require multiple sessions to see improvements. It's also important to note that laser hair removal is not always permanent. So you might have a significant reduction in the amount of hair, or the hairs that grow might be a lot thinner. But if you have any other hormonal shifts later in life, for example, you get pregnant or you go through menopause, you may get some of that hair growth back. So when I'm counseling patients about laser hair removal, I'm saying, yes, you're going to have significantly decreased hair growth, but it is something that may require maintenance sessions in order to continue that benefit. Sometimes when I talk about laser hair removal, I will get asked about at-home laser hair removal devices like handheld IPL devices. And while these are not technically a laser, they do have some technology that can help target and destroy the hair follicle. That being said, they are nowhere near as strong as what you would get in a clinic, but if someone is interested in trying that and it's not a huge investment for them, which is kind of paradoxical because in some ways, if you're avoiding laser hair treatment in the clinic, that's typically due to a cost prohibition. You can try at-home devices, but they don't tend to work as well. And while we're still talking about laser hair removal, I do want to talk about something called paradoxical hypertrichosis that can happen with laser hair removal. And this is the phenomenon of actually getting new and excess hair growth after laser hair removal. Now, this is pretty rare, but we do see it more commonly in certain ethnic populations like Mediterranean and Middle Eastern populations. So it's just something to be mindful of, and it's why if you're having laser hair removal done, you need to go to an experienced practitioner who knows how to avoid that complication or counsel you if you are someone who they're worried about that happening to. One thing I'll say is from my clinical experience, I find that for my female patients who struggle with excess hair growth, they're not typically going in specifically on one single intervention. They are often doing things like a birth control pill and using a topical and doing laser hair removal. And studies even show that that's how you get the best hair removal results. Do you have any hair removal products that you love, or have you undergone any procedures that have really helped with your excess hair growth? Please share them in the comments. As always, thank you so much for being here. Don't forget to give this video a thumbs up and subscribe to the channel, and I'll see you next time.